It is my honor today to welcome you to the Dentistry Conference, and thank you so much for coming. I just wanted to go over some brief reminders before we get started with our program today. Please remember to silence your phone or turn it off because we don't want it to be interrupting our presentations. There is no food allowed inside this building, so drinks with cups, lids are fine, but no open food. A little bit of a background for our conference. We started in 2003 at AMSA ARC, which is American River College in Sacramento. Then we moved over to UC Davis, and since then we've grown a lot. So we only had about 4 medical schools, 5 student volunteers, and only 231 student attendees. And this year, if you see the pavilion, it is packed. So we're pleased to announce that we have almost 7,000 attendees this year. And we have the dentistry, pharmacy, public health, and nursing portions. So I'm really happy that you guys could attend, and we're really happy to have been able to expand. We are a group of students. We have pharmacy students who are pre-pharmacy students, pre-dentistry students, pre-public health students, and nursing students, and pre-medical and pre-osteopathic medicine. So we've joined together and we formed an umbrella under which we combined and became the UC Davis Pre-Health Students Alliance. If you look on your program, you'll be able to find all the information regarding the workshops today that we're hosting especially for dentistry. It's on page 6, so you can look at that. We have the maps and a lot of different programs available for today and tomorrow. There will be workshops all throughout today and tomorrow, so you can feel free to ask us questions if you are confused about the schedule, but it is on the program. And if you are on the social media, please hashtag us at UCDPHSA13. We would like to see your pictures and know about your experience. I would like to thank the AAMCA for recording this video, this portion of the conference, and the UC Davis administration for supporting us this year, and to all the speakers and attendees and volunteers for helping us make this event possible. I would now like to invite Mike Stout, my colleague, executive board member and director of med programming, to welcome our next keynote speaker. Thank you.
Good morning, everyone, and thank you for coming. I like to think of it as the 11th annual UC Davis Pre-Dentistry and Pre-Health Professions National Conference.
There you go.
I actually had the honor of introducing our first keynote today, and I got the chance to talk with him earlier, and just a really approachable guy, and just happy that he could make it here today. His name is Dr. Richard Valachovic, and he is the president and the CEO of the American Dental Education Association, or ADEA, and the president of the ADEA Guys Foundation. He joined the ADEA in 1997 after more than 20 years in research, practice, and in pediatric dentistry and oral medicine radiology. He is a diplomat of the American Board of Oral and Maxillofacial Radiology and is certified in pediatric dentistry and dental public health. Dr. Valachovic has previously served on the faculty of the Harvard School of Dental Medicine, and during his tenure at Harvard, served as Dean for Clinical Affairs, Dean for Government and Community Affairs, and Director of Postdoctoral Education. He was also Chief of Dentistry at the Harvard University Health Services immediately prior to assuming the role of Executive Director of the ADEA. He has also served on the faculty as the Dean of Clinical Affairs at the University of Connecticut School of Dental Medicine. Dr. Valachovic has served as the president of the Federation of Associations of Schools of the Health Professions and as the founding executive director of the International Federation of Dental Educators and Associations. He is a member of the Washington Higher Education Secretariat. Dr. Valachovic earned his Bachelor's of Science degree from St. Louis University in Canton, New York, his D.M.D. from the University of Connecticut School of Dental Medicine, and he holds a Master's in Public Health degree and a Master's in Science in Health Policy and Management from the Harvard School of Public Health. He completed his residency in pediatric dentistry at the Children's Hospital Medical Center in Boston, and he flew in last night to join us in helping all of you become future leaders in dentistry. So please join me now in welcoming Dr. Richard Valachovic.
Thanks, Mike. And after all of that, I can assure you that my mother still wonders, when are you going to go into practice? And, you know, so I can send my friends' children to you. But anyway, thanks very much. All right, so we'll do it. I'm a PC guy. I'm not a Mac guy. There we are. I want to talk to you all this morning about the future of dentistry, that which I think you're going to be seeing over the next 10 years. I'm not going to talk about what has been. I think that if you're in this room, you have an understanding that dentistry is a great profession. We've been very successful. We have the chance to take care of people, to help them along the way, and to be part of a profession that really has many, many, many rewards. And so what I want to talk to you about today is what I see is going to happen over the next 10 years in education and in practice as you start to think about what your future might be. So 10 factors that will impact dentistry and dental education over the next 10 years. The first is that the public's perception of dentistry will continue to improve significantly. I think most of you remember some of the old movies that have dental references, you know, Is It Safe Yet? In The Marathon Man, I'm Your Dentist in Little Shop of Horrors, a whole variety. We've never really been portrayed all that well, and for many years, many generations, we were known for issues related to pain and other kinds of things. I think that's changed dramatically, and in fact, you need to transition my video, or does it? Look how easy Mac makes it. I'll try it again. Hit the, yeah, there you go. Hit that.
Just waiting for it to load a little bit.
Here we go.
These are snow globes, and we have a lot of them. We should get more. They're really cool.
I am Canadian.
Here's the best part. There it goes running. I think, first of all, I always say, how does that sell beer? I don't know, but I guess maybe in Canada things are a little bit different. You can put me back up.
Takes a second.
Takes a second? Yeah. PC wouldn't take any time. But let's think about some of the issues. You know, I mean, first of all, looking at her, you know, one has to think that with an oral presentation like that, she's probably had some pain and some suffering as a result of that. And we know the billions of hours of school and of work that are lost each year because of dental conditions. The social impact. I mean, there clearly was an opportunity for something to happen there between the two of them that the guy ended up running away. You know, the importance of not just a smile, but also of health really matters. The economic impact. I can assure you that if you don't have a smile, you're not going to be able to get a job even, would you like fries with that? I mean, there really is an importance of appearance now in the economy that we have, which is much more service-oriented as opposed to the old days that was manufacturing. If you were in a steel mill or in, you know, a car assembly plant, it wouldn't matter what you looked like, but it matters now. And national security. Remember that the #1 cause of deferrals for military service from the Civil War, when the draft started, through Vietnam, was because of oral status. Not enough teeth to chew on the to be able to eat on the battlefield. Other kinds of situations involving, I think most of you would know about wisdom teeth, periodontal disease, dental abscesses, and so on and so forth. The number one reason for draft deferments was because of dental conditions, and even in Iraq and Afghanistan, that was the number one reason why troops couldn't be deployed to those two theaters. I think that we all recognize that the dental profession is going to continue to be an attractive career choice, and we certainly have seen that surge. And I assume most of you know that U.S. News and World Report earlier this year ranked dentistry as the best job in America. Amazing that they've come to that conclusion, but we're grateful for it. And I think that overall, there are reasons to think that it is the best job of all of the jobs in America. Dentistry is ranked number one by U.S. News. Now, I do want to say some reasons why it's even potentially going to get better. There's about 186,000 people who have a dental degree and are professionally active in the United States. Of that, about 170,000 are in private practice. So that difference there of the 15,000 are the kinds of people like me who are in some kind of administrative role or something else. But what's important is that nearly 65% of dentists are 50 years of age or older. The median age of dentists in the United States now is 53. The median age of all other health professionals is 42. That's a significant difference in age, meaning that there's just some realities in life, maybe not taxes anymore, depending on what happens in Washington, but death is certainly one of them, and retirements. And so I think that, thinking that we're so much older than everybody else puts the opportunities for people coming into the profession. If we look at applicants and first-year enrollment trends over the past few decades, going back, so starting in 1955, the red line along the bottom is the number of first-year slots that were available in dental schools, and the blue line representing the number of applicants to dental school. You see that number of 15,734, that was the year I applied to dental school. It was a significant difference between the number of first-year slots and the number of people applying. Certainly, there was that bump that we see in the 70s related to the GI Bill, people coming back from Vietnam, the baby boom generation, and so on and so forth. But it also was the peak in the number of biology degrees that were given. And so then if you look after that, there was a period of time where the thought was that we had conquered dental disease. There was talk of the first cavity-free kids, caries-free generations. As it turns out, that wasn't the case. And even though we got down to almost 1-to-1 in the late 1980s, it's still, there still was a lot of dental disease out there and a lot to take care of. We had another peak just before the dot-com boom, and then the dot-com boom hit. People started to not go into the professions, and now we're back up again and relatively flat. But we're at about 2.7 applicants per first-year slot, very competitive, as you all know. That's actually the ratio is a little bit higher than medicine. Medicine's around 2.4 applicants per first-year slot, although the overall numbers are bigger. But this may be the first time in history that if you can't get into dentistry, I guess you'll have to go to medicine. So that's a situation we see now. But to counter this, we are seeing a surge in new dental schools. But it follows the closing of a number of dental schools. 7 dental schools closed between 1982 and 2000. Class size at many remaining schools were significantly reduced. So if you look, we were graduating about 6,200 dental graduates in 1980. We went down to 4,200 in 1990 and stayed about stable through the 2000. Now we're back up at about 5,000. But if you think about it, when we had 6,200 graduates in 1980, the population in the United States was 245 million. We're graduating 5,000, and our population is about 310, 315 million now. So the dentist to population ratio has changed. Here's where the dental schools are in the United States. You can see that the ones with the blue dots are the ones that are public, state-supported. The red squares represent those that are private, and the triangles represent those that are private by name, but receive substantial support from the state that they're in. So if you look at the ones that closed, there were 7. Oral Roberts was the first one, which is the medical school at Oral Roberts was the only medical school that ever closed. Then Emory University, Georgetown, Fairleigh Dickinson, Wash University, St. Louis, Loyola Chicago, and Northwestern University. All of them are private. There were a number of other dental schools that were on the block at that time for consideration to close, but those were all state-related, and they were able to. The schools and the universities were able to work with the legislature to keep them the legislatures to keep them open. But of these, 3 are Jesuit-related. One was Oral Roberts, the old story that the Lord was responding to the prayers of practicing dentists and to close dental schools and reduce the number of competitors, but that may or may not be the case. But look at what we've done since 1997. We've opened 13 new schools. And I can tell you that there's 7 more that are under serious consideration. So we'll probably end up with 20 new dental schools by 2020, so 20 by 20. So if you look, Nova Southeastern in Florida, UNLV in Nevada, as Arizona School of Dentistry and Oral Health near Phoenix, Midwestern near Phoenix, then Western in Pomona, California, Midwestern in outside of Chicago, East Carolina University, Roseman University in Utah, Lake Erie College of Osteopathic Medicine, their campus in Bradenton, Florida, University of New England in Portland, Maine, Missouri School of Dentistry and Oral Health in Kirksville, Missouri, University of Utah, and Bluefield College in Tazewell, Virginia. So of these, only UNLV and East Carolina are public. The rest are private. And most of them are associated with universities that have osteopathic medical schools, DO granting medical schools. So what happened there is, I think that you know that osteopathic medical schools were essentially separate from, they were private and independent. Over the last 30 or 40 years, they started to generate a university superstructure, and they now want to have a contemporary academic health center. So that includes a medical school, a DO granting medical school, a nursing school, a pharmacy school, and a dental school. So there's a lot of expansion going on, and opportunities continue to increase. I think we do have to appreciate that there's going to be other oral health practitioner models that are going to be developed. How they end up is yet to be determined. There's a lot of effort going on in a variety of different places. Certainly, you know that there are dental therapists on the tribal, within the federal Indian Health Service areas of Alaska, as well as in Minnesota. There's been expansion of some of the other hygiene models, including in California, and then a variety of other kinds of new practitioners going on, development going on. I think that what we're looking forward to is any of these new practitioners will be under the supervision of dentists. The independent model really doesn't seem to be gaining any traction. Our concern as a profession is really around the quality and the accreditation of these programs. I think that you know that there has been a standard curriculum at most dental schools traditionally. 2 years of, and just like medical school and other, 2 years of basic sciences. You take a national exam at the end of that 2 years, and then you go into 2 years of clinical sciences. That's sort of been the tradition. A lot of many of our schools have now made transitions to have basic sciences throughout the curriculum and clinical sciences throughout the curriculum as well. So many schools now you start seeing patients during your first year. I think that one of the things that we're starting to see already is that we've moved towards the flipped classroom in a lot of our dental schools. The lectures are recorded, made available. You watch them before the actual scheduled class time, and then the class time is devoted to what are the clinical implications of the lecture, what else is going to, how might you relate to each other as groups and so on. And I think that we're going to see a lot of MOOCs as well. And the MOOC concept that many of you are aware of, I think is going to prevail, but it's really just another way of doing the flipped classroom. This isn't going to be that we've got a university structure, that there's a dental school out there that's built just around MOOCs. The MOOCs will be an augmentation to the classroom activity that already is going on. The sixth trend, I think, dental education is going to become more like medical education. It's going to be much more community-based, part-time clinical faculty. There'll be full-time non-dentist research faculty. We'll be technologically advanced and much more influenced by the kinds of learning that you have been used to as you've come through high school and college experiences. Will be much more like the kinds of things that you've done instead of just a sage on a stage, as has been sort of the way that we've done things for a long time. The clinically community-based clinical opportunities, I think, continue to expand each year with each dental school. Through the 1990s, early 2000s, almost all clinical education that you would experience would be in the dental school itself. Probably 80% of the patients that you would see would be in a dental school clinic, as we have often referred to it, within the footprint of the dental school. You'd go out on some short rotations, but not a lot. I think that what we're seeing now is after you get, after you've been certified as being clinically competent to start to see patients outside of the dental school, clinical education is moving much more out into federally qualified health centers, into some private practices, into a variety of other settings, which I think students have really enjoyed those experiences of being outside and seeing patients where they live and not having them essentially coming into the dental school clinic. But along the way, I think that one of the things that you're going to see is that there's going to be a much higher expectation of scholarship and research within dental schools. Dental Dentistry is very much like medicine in that about 80% of the research goes on in about 20% of the schools. Just like in all of health professions, the majority of the research goes on in just a small number of the schools because you have to have an infrastructure that supports that research. And so in California, for example, UCLA and UCSF are extremely well known for their research. But I think that all universities are going to be pushing research and scholarship in different ways, and that will only benefit you when you get to dental school by being in a place that really focuses on science and the development of evidence for new types of treatment. Along the way, I think we're going to see changes in accreditation standards and testing methods that are going to develop. One of them, for example, as I said, since the 1930s, there has been a set of national board examinations that you would take part one at the end of the second year of dental school and part two at the end of your fourth year of dental school. The part one relating to the basic sciences and part two relating to the clinical sciences. And what happened then was you took, there were all these basic sciences, you took the part one of the exam, and then you put the basic sciences away. That's all I need to know, right? And then you take the second half, the clinical sciences, and they all had grades. Now, the boards the purpose of the boards is to certify to the state that you have a basic level of knowledge in order to get a license. It wasn't meant to be some national exam of competency. It was just you have the basic knowledge to be licensed by a state. So a couple things have happened as a result of work that we were part of as well from the dental school's perspective, is that there's now going to be one exam. It'll probably not begin until 2020 or something like that, so it may impact some of you, may not. But the design is that, and it's still under construction, but the concept is there. There'd be one exam, and already it has moved to its pass-fail. You either pass it or you don't. So that there always is a challenge of when you have exams like that, as you know, that the curriculum needs to be prepared to teach to the test. And hopefully one of the things that will happen is we'll move away from that. I think that we know that we have had traditionally a real challenge. The discrepancy between the diversity of the dental profession and the diversity of population will result in dramatic political pressures. I think that we have been extremely active in trying to get create opportunities so that no matter what applicants' backgrounds have been, that they can become prepared for the rigor of dental school. And one of them is that we've worked with the Association of American Medical Colleges on the Summer Medical and Dental Education Program. I think that some of you may be aware of that. 1,000 students each year who are at the end of their first or second year of college go to one of 12 universities, 9 of which have medical and dental schools, 3 of which have just medical schools. But they come from either underrepresented minority background or low-income backgrounds, and they take crash courses in organic chemistry, calculus, physics, teaching skills, and so on, study skills, and so on. And as a result of that, enhance their opportunity to get into dental school and into medical school. You know, so much, you know this already, I mean, over and over again, but so much is going to change in society over your lifetime. I mean, if you're going to be graduating from dental school in, sometime between now and 2020, you're going to be practicing until 2060. And I mean, for those of you in California, you know what's happening already. But even just if you were to look overall at the entire population of the United States, no matter what state you're talking about, there's going to be dramatic changes over that time. And we're trying to do everything we can to prepare a workforce that more closely reflects the society that we're trying to treat. If you look at the trends of underrepresented minority applicants to U.S. dental schools, the blue diamonds represent the Asian Pacific Islander population, and those trends are completely consistent with overall trends for all races. But if you look, we've been somewhat successful through this summer medical dental education program in particular, I think. Black, African American, and Hispanic Latino sloping up over the last years that we were monitoring this. And I think finally, globalization is going to have an intense effect on dental education, creating incredible opportunities and challenges. I think that a lot of this will come from the parent university itself. I think that many of the universities that you are at and studying at now have some kind of global activity going on. And some of it may be in a foreign country, some of it may be bringing people from other countries into the United States. But I think that globalization is going to have an effect. Dentistry will become part of that education model. And I think that there's going to be tremendous opportunities for the future, as well as preparing our students for practicing in a global world. But I think that there's going to be a lot of challenges along the way as well. It isn't easy. Those of you who have been involved in global health, it's not easy, and creating careers can be a significant issue. So I think that the future for you folks is tremendous. There's great opportunities out there. The private practice of dentistry, as we've known it, sort of the 1 or 2 person dentist in a small office with a relatively small staff, is going to continue. But there's a lot more opportunities now within some of these organizations that are creating some what is often referred to as corporate-based dentistry. Those of you who know about Aspen Dental, Pacific Dental, Heartland Dental, and others, where dentists serve as employees, as opposed to being small business. If you're in a private practice alone, you have to also be a small business owner as well. You have to worry about all of those things in addition to taking care of patients. A lot of these new situations create opportunities for you to, you go in at 8 o'clock, you start seeing patients, you leave at 5 or 6 o'clock, and you don't have to worry about all the billing, insurance, personnel issues, all of those kinds of things. So great opportunities. I think that you have the world as a real chance to do great things, to do well, to be successful, and to have a long career of great joy and opportunity. So thank you very much.